A multidisciplinary approach is required for appropriate use of medical imaging. It plays a crucial role to helping us view the human body for diagnostic and treatment purposes. The need for imaging is especially paramount within the cardiac region in which lies our heart, the most vital organ. Some imaging modalities that can be used for the cardiac area are a standard chest X-ray, CT scan, MRI, MRA, and a PET scan. All of these differing techniques are used for viewing the specific parts of the cardiac region and assessing different conditions. We will be comparing and assessing these techniques by considering its cost, safety, and their overall contribution in successfully and accurately being able to diagnose an issue.
The first imaging modality that we will be exploring is the computer tomography scan. Tomographic imaging is usually a slice through the viewed area, in this case the cardiac region, and by using X-rays has full 3D localization and improved soft tissue contrast, which is ideal for imaging of the cardiac region. This is a form of anatomical imaging rather than the functional, viewing the structures within the heart. An iodine-containing contrast is usually administered to the patients as it attenuates X-rays much better, improving the quality of the image. Using CT for angiography, calcium scoring, and using multi-detector apparatuses have been successful in evaluating conditions such as pericarditis, any disorders of great vessels and cardiac tumours, and for evaluating for the presence of plaque in the coronary arteries walls. So now it is important to weigh up the benefits and limitations in order to assess it. This modality is non-invasive, relatively quick, and its cost aligns with its positive diagnostic outcome, being around $0 to $300 out of pocket with either a GP referral or bulk billing. But in saying this, as X-rays are used, there is an amount of radiation that will be exposed to the patient, which remains a major limitation of this modality, and also the possible side effects and an allergic reaction to the contrast dye. Imaging of the heart has proven difficult in the past, as the contraction of the heart allows the production of motion artifacts. Hence, the shorter time taken for a modality to image the cardiac region, the better. Issues arise with patients with arrhythmia, as CT angiography is preferable with those with a stable heartbeat and a normal breathing rate. A temporary solution which alleviates this problem is the oral administration of beta blockers, which help to reduce heart rate, which in turn leading to an image with a more superior quality. Currently, 64 slice, 256 slice, and 320 slice CTs are of use, and here lies the question of which one is the best system in terms of cost and effectiveness. The 256 and 320 slice CT scanners capture a superior quality 3D image of the heart in a much shorter time, but in saying this, motion artifacts and beam hardening is still seen to occur. Here are the two resulting images of the CT scanners for comparison. As the slices increase, cost increases, so there needs to be great consideration in which one is suitable for the patient being imaged. Hence, computer tomography imaging of the cardiac region is seen to be very beneficial in being able to diagnose the condition. This then leads to the effective treatment or post-imaging planning to aiding the patient in gaining a healthier cardiovascular health. These conclusions are backed up by many journal articles that suggest the high sensitivity and specificity levels of this imaging modality.
So now I'll be talking about the positron emission tomography, also known as the PET scan. The PET scan has been deemed to be one of the most effective treatments in treating and diagnosing cardiac disease. PET scans are an effective way to examine the chemical and metabolic activity in the body and are extremely beneficial when detecting coronary heart disease. The images produced by a PET scan vary significantly and provide different information than other scans such as a CT and an MRI. So a cardiac PET scan is a non-invasive diagnostic test which evaluates the flow of blood to the heart. During the test, a small amount of radioactive tracer is administered as well as a radioisotope with a natural body compound. The radioactive tracer used is fluorodeoxyglucose, FDG, which combines the natural glucose in the body to fluorine 18. This radiopharmaceutical is used in CAD detection as it measures the body's metabolic reaction to FDG. In cases where there is disease, or the heart muscle is damaged, the impaired metabolic action will be present, which you can now see in this image shown on the screen. PET imaging in cardiac disease is undertaken in two stages. So during the first stage, PET utilizes the administration of FDG while the patient is in a state of rest. These images produced in this first scan will be used in comparison with the second. So the second stage consists of the administration of dipridamole, which is a drug that produces an effect in the body similar to that of strenuous exercise, hence producing images of the arteries in a state of stress. During the first stage of PET, despite any constriction of blood vessels or valves in the heart, normal blood flow may be maintained. However, it is through the second stage of PET that the detection of any heart disease can be made. Due to their comprehensive and accurate approach, PET scans are very beneficial as they are highly unlikely to be distorted by conditions of the patient's body. And it is through the use of nuclear medicine scanning techniques that it yields useful and unique data enabling diagnosis and appropriate treatment plans without the use of surgery. As well as this, PET scans are cost-effective and may detect disease before it's even evident in other tests. There are also risks associated when undergoing a PET scan procedure. These risks include an allergic reaction to the radiopharmaceuticals, however they are very rare and usually mild. Women who are pregnant or breastfeeding should not undergo this type of procedure. If CAD is present during the stress test stage, patients may experience chest pains and discomfort. Due to it only being administered at a small dose, radio exposure is low, therefore this radiation risk is quite low compared to the potential benefits of the exam. There are limitations of PET scans. So these limitations include that PET scans are very time consuming, also that the test results of patients who are diabetic or patients who have eaten a few hours prior to the exam can be affected due to the changes in the blood sugar or the insulin levels. The last limitation to a PET scan is due to the radioactive substance having a short half-life. It decays quickly and is only effective for a short period of time.
The next imaging modality that we will be examining is magnetic resonance imaging, which is also known as MRI. MRI is an advanced imaging modality that uses magnetic field and radio waves to construct images inside the body. MRI utilizes the body's natural magnetic properties, the proton in the water molecule, to produce a detailed image from the desired body part. Normally, the water molecules inside our body are randomly arranged, but upon entering MRI scanner, the two magnets of the scanner causes the protons to be aligned in one direction, either south or north. This magnetic field is triggered by passing an electrical wave through a gradient coil that vibrates, resulting in a knocking sound inside the scanner. The main purpose of this imaging technique is to evaluate heart muscle dysfunction and to diagnose tumors or brain disorders. Altogether, magnetic resonance angiography is observed to have a huge impact in today's society, as it allows radiologists to assess the health of blood and lymphatic vessels in our body using the images constructed by this imaging modality on the computer. Thus, this modality helps in the early diagnosis of serious life-threatening diseases such as atherosclerosis. In comparison with CT scans, this modality also has a non-invasive procedure. Other advantages of MRI include its lower risk of allergic reaction, production of clearer cardiovascular images, and the fact that it does not use ionizing radiation to make it a safer option for diagnosis. However, every modality has a positive and a negative impact on the patient. Some of these negative impacts include its costly, lengthy, and noisy procedure, which sometimes results in a rejection from the patient to undergo a diagnosis using this imaging technique. Other disadvantages to this modality comprise a lower spatial resolution, its incompatibility with life support systems, and claustrophobic patients may require sedation. Magnetic resonance angiography, or MRA, is a type of MRI that requires the insertion of a contrast material called gadolinium to be able to see the condition clearer. The importance of using this instrument is to evaluate the condition of blood vessel inside the body. For example, it will help in the identification of thrombosis, the clotting of a blood vessel, or abnormalities. This imaging modality has its unique positive features that makes it used more than MRI for some diagnosis. Besides its use of non-ionizing radiation and non-invasive procedure, the advantages of using this modality over MRI include its high spatial resolution, quick procedure, and most importantly the fact that it is less expensive than MRI. On the other hand, this instrument has a few downsides that makes it unreliable to be used too often in diagnosis of several diseases. Some of its negative aspects include the inability to depict slow blood flow in small blood vessels, which makes it difficult to diagnose some angiographic diseases. Another disadvantage is that claustrophobic patients may require sedation. The last downside of this technology is that signal loss may occur due to high calcification in blood vessel or by metal artifact.
In summary, we believe that realistically one method is not going to be better than another in the fact that they all have different specific contributions. But rather we can conclude that one will always be more effective and a better option in viewing for whatever is required than others. All modalities listed are non-invasive examinations, which is a major benefit in diagnosis and treatment. However, there are disadvantages such as ionization radiation in X-rays and CT. not cost-effective and low spatial resolution in MRI, signal loss due to calcification in blood vessels in MRA, and low resolution of anatomical structure in PET.